Hi, I'm Kelly and I'm a hospital pharmacist at Legacy Good Samaritan Medical Center. Today I'd like to talk to you about some of the medicines that you'll be going home on after you go home from the hospital after your bowel surgery. The first group of medicines I'd like to discuss is your pain medicine. It's important to stay pain-free after surgery. Decreasing or eliminating your pain is important for a number of reasons. Being pain-free boosts your immune system, helps your appetite, it will help you sleep better, and it will get you back on your feet and moving again. You'll be given a prescription when you go home from the hospital for pain medicine. This medicine will contain an opioid or a narcotic. Examples of these medicines are oxycodone and Lortab. You probably received these pain medicines or something similar while you were in the hospital. So let's talk about how to take the pain medicine. You should only take your narcotic pain medicine when you experience pain. Don't take it automatically, just 3 or 4 times a day if you have pain. As you get further out from your surgery, your pain should start decreasing. If it doesn't, you should call your surgeon. Your need for narcotic pain medicine should become less and less within the first week or so after surgery. If you've been using the pain medicine more than a week, it's wise to taper down over a few days. But this does not mean you are addicted. It just means your body needs a few days to adjust to having less pain medicine around. You can taper down your pain medicine by just taking 1 tablet instead of 2. Or just take a half a tablet instead of a full tablet. Everyone is different. Some people do not need any narcotic pain medicine after surgery, while others may need it for a week or 2 after surgery. In addition to your narcotic pain medicine, we would recommend that you also use non-prescription or over-the-counter medicines to help relieve your pain. Examples of these include acetaminophen or Tylenol and ibuprofen, also known as Advil or Motrin. Our general advice is to use Tylenol 1,000 milligrams 3 times a day. We also recommend taking the anti-inflammatory medicine called ibuprofen 600 milligrams 3 times a day. The Tylenol can be taken at the same time as the ibuprofen. If you prefer, another anti-inflammatory medicine called naproxen or Aleve can be used instead of the ibuprofen. But don't use both ibuprofen and naproxen together, as they are very similar medicines. When you feel that you do not need your strong pain medicine or narcotics any longer to relieve your pain, you can just use the over-the-counter pain relievers as long as is necessary. We would not recommend taking Tylenol if you have severe liver problems, and we would not recommend the anti-inflammatories such as ibuprofen or naproxen if you have severe kidney disease or a history of bleeding stomach ulcers. Another important part of taking narcotic pain medicine is to avoid constipation. These medicines can cause constipation. Our goal is for you to have 1 bowel movement a day. As long as you have at least 1 bowel movement a day, you don't need to take any laxatives. If you stay well hydrated after surgery and eat plenty of fruits and vegetables, your bowels should work just fine. But if they don't, or if you miss a day or 2, you'll need to take a laxative. We recommend either generic Miralax or milk of magnesia, taken once or twice a day. You should continue one of these medicines until a bowel movement occurs. Your surgeon will generally advise you prior to your hospital discharge whether or not you need to routinely take anything else to keep your stool soft. If you go several days without having a bowel movement, or if you begin experiencing increased abdominal pain, you should contact your surgeon's office. Remember, after surgery, it's important to stay pain-free. Take your narcotic pain medicines only when you need them, and be sure to routinely use the over-the-counter medicines that we talked about. Avoid constipation by eating a healthy diet and use a laxative as needed in order to have 1 bowel movement a day. If you have any questions at all about the medicines that we've talked about, be sure to talk to your pharmacist who fills your prescriptions, or there's pharmacists in the hospital that would be glad to talk to you before you go home. Thanks for listening, and best of luck on your road to recovery.